Good morning. I'm going to be the nurse for today. My name is Lori, and I'm going to be administering medications to Millie Larson. Date of birth is 1/1/36. No known drug allergies. And I'm going to be administering Haldol 2 milligrams intramuscular for agitation. And I am given Haldol 5 milligrams per ml. So I will be giving 0.4 milliliters mLs. I'm also to be giving Lispro insulin 10 units subcutaneously with breakfast. This is to control the blood sugar. And there's 100 units per ml of the Lispro. So I'll be giving 10 units. And then Colace, 100 milligram tab. I have Colace, 100 milligram tab. That's one tab. This is a stool softener. Perform hand hygiene. The first one I'm going to do is the Colace. So that's Colace, 100 milligrams. 100 milligrams. Expiration date is 6 of 2024. 100 milligrams Colace. One tab to be given now for stool softeners. The next thing I'm going to be doing is the insulin, which again is Lispro insulin, 100 units per ml. Give 10 units to control blood sugar. So you take off the top. This is my alcohol pad. You scrub the top with the alcohol pad. You open the syringe. So this is going to be a 1 ml, 29 gauge, half-inch syringe that I'm going to be using for the subcutaneous. So we open this up. We pull it back to 10 units. Take off the cap. Push in the air. Invert the vial. Draw up 10 units. Put the cap back on using the scoop method. This is my 10 units of insulin, the Lispro insulin. I'm going to mark this on a piece of tape. 10 units Lispro insulin. Okay, so I mark this on my insulin. The next thing I'm going to draw up would be my IM injection, which again is the Haldol, 2 milligrams intramuscular for agitation. Again, I'm giving Haldol 5 milligrams per ml, so that means I'm going to be giving 0.4 mLs. I'm going to be using a 3 ml syringe, and I'm going to be using a 23 gauge 1-inch needle. I'm going to assemble this. Twist that on until it locks. I'm going to be opening my alcohol. Clean the top well. So again, it's 0.4. Draw up 0.4 of air. Remove the cap. Push in the air. Invert the bottle. Draw up the 0.4. Okay, so that's 0.4 of Haldol. I'm going to replace the cap of the needle but using the scoop method. Now I'm going to write on here to mark my, so this is Haldol 0.4 ml. And again, this is for agitation. So it's Haldol 0.4 given to control agitation, and this is due now. I'm now going to see my patient now that I have everything set up and ready to go for my patient. Knock on my patient's door. Hi, Millie, it's Lori. I'm here to give you your morning meds. Can you verify your name and date of birth for me? Here's your bracelet. Okay, so it's Millie Larson. Millie Larson. 1136. 1136. No known allergies, Millie? No known allergies. Thank you so much, Millie, for verifying that. So the first thing I'm going to be giving you is the Colace. Colace 100 milligram tab. 100 milligram tab to be given now as a stool softener. To be given now as a stool softener. So I'm going to open this up. In the cup. Here you go, Millie. Take this with some water, honey. Thank you. The next thing I'm going to be giving is the Lespro, which is the insulin. Let me wash my hands again. And let me put on my gloves. And here is my pretend person. So the insulin I'm going to be doing in the abdomen. So if this is the umbilicus, I would do 2 fingers down from the umbilicus, and I'm going to do the lower left quadrant. So here we go again. Lispro insulin, 100 units per ml. So I'm giving 10 units subcutaneously to control blood sugar. I'm going to take off the needle, pinch the skin, insert the needle at a 45-degree angle, inject the medication, put my safety on, and put it in the Sharps container. Oh, I forgot to rub my alcohol. So first, before I give the injection, I would clean the area with alcohol from the middle in a circular motion out to the edges, and then I would pinch, inject at a 45-degree angle, and then put the safety cap on, and then insert it into the Sharps container. So now my next one I'm going to be doing would be my Haldol, which would be Haldol 0.4 milliliters, and it's supposed to be 2 milligrams given. So again, it's 0.4 milliliters, and I'm given 5 milligrams per ml, and this is for control of agitation. So this is an IM injection. So I'm going to be using the deltoid. So you would measure 2 fingers down from the top of your shoulder, your clavicle, like on the side. So at the top of your shoulder, 2 fingers down. So 2 fingers down on the deltoid muscle. Again, you clean from the outside in a circular motion. Okay, all clean. You remove the top to you hold the skin taut, 90-degree angle, inject, remove, safety, and you put it into the Sharps container. I'm holding it because it's sprayed back out at me. So that's why I was holding it. You're not supposed to. After I do that, I take off my gloves, wash my hands again. And now I would document my meds were given on the MAR, the time being 9:20 a.m., the site where they were given, how much I gave, and my initials. Thank you.